Dear colleagues, I'll be fast. Not many time we have, so let's start. First of all, I want to show you some numbers. This is the prevalence of urolithiasis in Russia, and in Russia something like 900,000 people is fixed with urolithiasis per year. But I want to stress your attention to the point that something like more than 60% of patients with urolithiasis comes to our department for emergency. More to say, something like half of all urologic department, it is the patients with urolithiasis. More to say, something like 50% of patients who now are in our department will return there in 5 years. It is somehow normal for us, but we should think about and we should change it. Do we have nice studies of how to assess the real prevalence of urolithiasis? This is one of the studies. It is the study from Wisconsin, and this study shows when they try to do screening of colon cancer, they used a CT for patients without symptoms from urolithiasis, and they stressed that practically 8% have stones, 8%. And what telling about urolithiasis? In England, they count that they pay more money for urolithiasis than for prostate cancer and bladder cancer together. What we have? Can we do just ultrasound for all persons in our country? No. I found 3 studies. Noor Burholz in 2003 made UC screening in Pakistan, in Russia, and Tahin in Iraq. And you see that the percent of urolithiasis which was found was practically the same, only 4 or 3%. And it is not enough, because you do 97% of ultrasound for free. There is no idea to do it. We are urologists. We know the IPSS scale very good. But do we have IPSS for urolithiasis? I think it is a good idea to have such a questionnaire. What questionnaire for urolithiasis do we have? First one is a Japanese one, but it is difficult. Look at the maths. I don't know how to count it at first. The second, we should know, for example, the level of creatinine and albumin and uric acid. You should test blood. It's expensive. We know that there is a good questionnaire, ROX, but it is questionnaire for recurrence, not for the presence of urolithiasis. And that's why we decided to make a questionnaire to find the urolithiasis in our patients. There are 8 questions, simple questions. They are something different, men and women. And what we did, there is such a region, it's called Chuvasha, and we took 3,500 people to test this questionnaire. These people come to ambulance just for all cases. For example, for taking medical card for driving license, or for maybe arterial hypertension, no matter, but they just come to the ambulance. And what we do, they fill the questionnaire, and then all for them ultrasound and CT. What we found? Look, and I want to stress it. You know, we assess urolithiasis as a surgery, but if we look, only 7% of people which stones we found For example, we found 11% of stones in this population. 11% of stone, people had a stone in ambulance. And look, only 7% of stones needed surgery. The stone which was more than 7 millimeters. And all the less stones, 94%, it is a small stones. But if we will do nothing, this stone in the future will need surgery. So if we really want to make some prevention, we should treat these stones, not those. So there were a lot of disease, main disease of respondents that were the reason for seeking medical care from general practitioners. There were all like cardiovascular and gastrointestinal and so on and so on. More patients have a two summary of points of this questionnaire. What stones was? The prevalence of low polar stones was 67% and medium calyx was 16%, and there was a statistical significance. Men had 1.5 times more stones than women. And so we decided to assess the sensitivity and specificity of this questionnaire. That is the goal of our study, and we found that sensitivity in men was 80% and specificity 57%. And speaking about women, there was 72% of sensitivity for women and 70% specificity for women. So, what are the results? In this region, in this town, there are two hospitals. So, in one hospital, we made this program of screening urolithiasis, and another they didn't. So, what is the difference? Look, the level of emergency hospitalization decreases in the field where we use this questionnaire, and also decreased the hospital stay, because of we don't need to cure emergency pyelonephritis and so on. And what about money? Of course, we counted money, and this approach, when we use questionnaire and ultrasound, is the cheapest one. So we think that if we really want to make a prevention in urolithiasis, when we want to decrease the level of emergency, we should use such a questionnaire to help our patients and to go out from difficult circumstances in urolithiasis. Thank you for your attention.